So welcome everybody, welcome again to those of you in the room, welcome to those of you joining us online. As Lydia said, today our focus is very much on research and what opportunities we might have and what direction and pathway we might be taking. I just want to take a moment for everybody, because this is why research is so very, very important. Very, very sadly, one of our individuals with Ring20, Christopher Hamilton, aged just 9 years of age, passed away a few weeks ago as a result of uncontrolled seizures and his Ring20. And I just think if we could just have a very few seconds just in respect of the family, send our best wishes. But this is why Ring20 research has to be on the agenda, because this cannot happen to other people with Ring20. Okay, I'm going to start with some of the things that I say when I'm out there speaking, raising awareness of Ring20 amongst healthcare professionals, researchers, scientists, trying to get people interested in Ring20. We face three key challenges. Firstly, a diagnostic challenge. I think most of you, our member families, are very much aware that there's only a very specific way in which we can diagnose Ring20, and that is creating a problem with underdiagnoses of this condition. So that needs to change to find more people that actually have the condition. We also, as you all know, have a big treatment challenge. We have no recommended treatments because of the limited research that's been done. And because there's no recommended treatments and limited research, we have no clinical practice guidelines for doctors to be able to follow when they're determining what treatment to give you. And because we have no patient registry, a database, a list of every individual that has Ring20, we're not really on the radar for clinical trials, and there never has been a clinical trial for a new or an existing medication for people with Ring20. Our third key challenge is in the area of care. Okay, when medicine doesn't work, it's how you cope day to day. That's really, really important. And many of you know, and this is how you live day to day, there's a real range in Ring20, but many individuals need support in care in many aspects of their daily life, whatever age they are. And I'm sure many of you will recognise these. Now, there are actually just over 10,000 rare diseases that have been recognised. Ring20 is just one of those thousands of rare conditions. And it's also one of 130 plus rare and complex epilepsies currently defined. So we're a tiny fish in a big ocean. And that presents a big challenge because we are competing against all of these other conditions in the research space for people to be interested in researching Ring20 and finding some solutions and answers for us. So I say, Ring20, we're not on the radar. And that's what we need to change. We need to get people aware of Ring20 and looking and listening to us, because that 10,000 rare conditions is exploding with the advances in genetics, the advances in EEG and MRI. More and more conditions are being recognised, but not Ring20. And yet the way in which treatments and therapies are being developed today, they're looking disease by disease. So how in our lifetime are researchers and scientists going to look at all 10,000 diseases? We may need to make them step up and listen. So that's why we need interest in Ring20 research. Now research, I'm not a medical or scientific expert, I'm a mum, okay? So there are many, many different types of research. Research is not just looking under a microscope, sitting in a lab. Research can be on individuals, on families, can be talking to you, your doctor's talking to you, asking questions, asking for questionnaires, looking at different treatments and how you respond to that treatment. Does it work for you or not? So many different types. It comes in many different forms. Sorry, I'm going the wrong way. Oop. So that's why we've developed a Ring20 research strategy. We are not going to sit there and wait for the world to come to us, because it's not going to happen. We have to make this happen. So we are driving patient-led research. This is coming from us, the community, to drive our own research strategy. And we're looking at it from 4 key areas: diagnostics, prognostics, therapeutics, and causes. Because we want to ultimately find a pathway to, whether it's precision medicine, something that's more effective for you and that works for you, ultimately a cure. But even, hey, if we had something that works, that'd be helpful, right? So I'm going to give you a little bit more of a really simplistic view, very quickly if I can, of those 4 key areas, and really bring it down to family level, because I've had to learn how to digest this. So diagnostics. Ring chromosomes occur in 1 in 50,000 births. So why have we only got 200 reported cases of Ring20 in the whole world? There must be thousands of cases of ring chromosome 20, not reported or not diagnosed. Many of you answered our survey in the last year or so, and that showed us that of our member families, when we got up to about 2010, there were steady increases in number of diagnoses and reporting, but that's now started to become in decline in the last 10 years or so, and that's a worrying trend. And of our member families, if we just look at the UK alone with 35 families, 3/4 of the individuals are actually adults now. So we're not seeing young children being diagnosed coming through to our support group. So that's a big problem. So what's the solution? Potentially 2-pronged approach. We need to raise awareness of how to diagnose and when to test. But ultimately, we need to find an easier way to diagnose Ring20. But you guys might be thinking, well, I've already got my diagnosis. What's this matter to me? Well, actually, if we have a better understanding of the number of people that are affected by Ring20, the more people that are diagnosed presents more opportunities, more interest for research, and potentially an increased demand for improved care for all of you. Prognostics. Okay, strange word. Simple terms, what's the future going to hold for me? So how's Ring20 going to affect me as I get older? The problem, you don't know. Will your symptoms change? Will they get better? Will they get worse? Will they stay the same? What support will I need? How can I plan for the future? Our solutions are to build a natural history study, and we'll hear more about that from Professor Zubairi later on today, and a patient registry. That database, that list of the number of people that have Ring20, the natural history is all about recording how people are affected, so that you can look at, with lots of people have been affected in this way, perhaps this is how I might be affected in the future. So we can learn from that. Why does that matter to you? Well, it documents the reality of living with Ring20. What's it really like? Not what it says in the literature, because there's not enough in the medical publications. A lot of doctors say to me, and this really frustrates me, Ring20, oh, it's just absence seizures. Look around people in the room. No, lots of shaking of heads. We need to know how to plan for the future. I've said that before. And we need vital, basic information for future research into treatments, because these are the basic building blocks, hence the house, the foundations of new research for us. We're driving that, we're funding that. Therapeutics, treatments. Why are there no effective treatments for people with Ring20? The problem? You're all typically treated on a trial and error basis. I mentioned there are no guidelines for your doctors to follow. They just have to treat you the same as they treat anybody else who doesn't respond to anti-epileptic medications. Let's try, let's try, let's try. There's a lack of basic research. Most of the medical publications talk about single case studies, or I have 1 or 2 patients who blah, blah, blah. It's not helpful. We've talked about limited opportunity for clinical trials. You're not getting an opportunity to try new treatments. There's a big problem out there. We'll talk about that later. And there's limited opportunity for even open access to medications. Now, what does that mean? Most of you probably haven't got a clue. You know, there are newer emerging anti-seizure medications out there on the market that are licensed for particular types of epilepsy, but not Ring20. But some doctors will allow you to trial that and others won't. The solution, we want more studies, observational studies. Your doctor giving you a medication that they think might help and observing how you get on with that medication rather than a formal clinical trial. Drug repurposing, in a nutshell, that's about using an existing medication and using it for Ring20. But the researchers and the scientists have to look that that medication could possibly be helpful and then doing a much faster trial to see if that's effective and helpful for you. Brand new, real targeted medications that are targeted towards their, to be helpful to Ring20 and more clinical trials. And how might that affect you? Well, we want to try and find a treatment that actually works and improves your quality of life, your daily life. Causes. Last area. The big problem with finding new medications is we don't understand the problem. We know you've got a ring chromosome, the ends stick together, you've all been watching Unravel, but we don't know why that ring formation causes the seizures and the other problems that you see. Ring chromosomes, I'm told, by the scientists, are really complex biology, and that's why perhaps we're not getting the interest, because it's not going to be easy to find the answers here. And we don't understand what that ring has on the effect of how our bodies work and why it causes the problems. So the solutions are about, we need to drive for more lab-based research. We need to look at cellular models, growing Ring20 in a dish and seeing how it behaves. I'm not going to go into all that. Animal models, you've heard about mouse models. Maybe some of you would have heard that you give a mouse Ring20, you give it a disease and you give it medication and you see how that mouse responds before you trial that medication on humans. But you need basic science before you can get a mouse to have Ring20. And unless you get any of those, you can't even think about getting gene therapy to try and sort the problem out at a genetic level. So why does that matter to you? Well, if we understand why that ring causes our bodies to behave differently, we understand the underlying cause of the problem, and then the scientists can actually start towards working a solution because they know what they're dealing with. At the moment, they don't. So that's why we've built a 4-pronged strategy. It's different approaches to give us all the clues to the puzzle to try and understand Ring20, the bits that we don't understand. And we want to build that puzzle piece by piece. It's not going to happen overnight, it's not going to be easy, but we want to try. And that's why we're partnering with scientists, with geneticists, with clinicians, with pharma. We're collaborating, and we've got some fantastic collaborators and partners that you'll be hearing from later today that are now working with us, I'm incredibly proud to say, to start on this journey and make this happen. Thank you.